Salicylic acid is a great way to make corns and calluses go away. And here's a little corn. It's a little hard nub of hard tissue. It's a little bit different than a callus, as you can tell right here. A corn on the left is a hard little nub. It looks like a corn kernel, whereas a callus is larger and diffuse and more superficial. The corn causes more deep pain. And it's not uncommon to have them both together. Here you have a corn in the middle with a callus that forms around the outside. So as the callus comes down, you could almost pop the corn out like a little pebble, sticking into your deep tissues. So salicylic acid, this is probably the primary over-the-counter treatment. The main reason is it works and it's very cheap. You can get any of these bottles for under $5. They already come pre-packaged, specifically made for your foot calluses. I'm not going to mention any special brand names, but they come in pads that you can just stick on your callus. You could apply them in an applicator for 5 minutes, whatever, or a cream that you can even smear on. And what's going to happen is, after a couple days of rubbing it on your callus is going to turn white and kind of start to peel away. But they don't toss in the extra stuff. Here's other stuff you could do as well as use salicylic acid. Moisturize your callus. Before you go to bed at night, rub some petroleum jelly, any type of moisturizer, into the callus. It's going to make it softer and make even the salicylic acid more effective. You could use Epsom salt baths. Put some salts in a foot bath, soak for 10 to 15 minutes or so, then use the moisturizer later and even the salicylic acid. You could then use a pumice stone or an emery board to debride the callus and the corn. And because it's pressure areas that cause these calluses to form, you could also take some anti-inflammatories like ibuprofen with the recommendation of your pharmacist or podiatrist, of course, to relieve the pain as the callus pain starts to go away. So we looked at pumice stones, anti-inflammatories. You can even add gel pads. These are very cheap and fantastic. You won't even feel they're there. If there's a bony prominence or something causing pressure, such as the corn, then use it to cover that. I guarantee you'll feel better. Moisturize and take the foot baths. But in the long run, there's a reason you're getting these corns and calluses to form, as you can see on the right. If there's a deformity, if a bone's pushing against your skin, it's rubbing against the ground, it's causing calluses and corns to form, bunions or bumps on the outside of your foot. All these things do it. So in the end, the only real non-band-aid solution is to go see your podiatrist. And hopefully this was a benefit to you because it showed you that an even bigger problem with your biomechanics is forming that you can take care of.
Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.